Hello, I'm Dr. David Torres. I'm a clinical psychopharmacologist, and I'm here to talk about performing an Abilify 10 milligram test dose. In emergency situations, it is important to treat severe dysfunctional emotional symptoms acutely, and decisions to treat are often done in the face of uncertainty. A lack of information in an emergency room or hospital setting is not uncommon, and the benefit of treating someone in distress often offsets uncertainty of diagnosis in the face of drug or alcohol use. A test dose of any medication should be high enough to promote a response or at least a 50% improvement in symptoms within 2 hours without causing cognitive impairment. 2 hours after taking a test dose, while accompanied, the person should contact the prescriber to make them aware of any side effects such as nausea or headache, which can occur with Abilify at higher doses. Having knowledge of the response someone has to a single test dose can be very valuable. If someone has symptoms again in the future, they will know that the same medication at the same dose will have the same effect as it did initially. Knowing how a medication performs at home first is important for people who travel across time zones on a business trip, for them to get a good night's sleep before a meeting. When severe symptoms of anxiety, racing thoughts, irritability, impulsivity, and insomnia are present, we have many options for treatment. But one option for treatment which does not cause cognitive impairment is to use an Abilify 10 milligram dose, which acts as an anti-anxiety agent, an antidepressant agent, and an antipsychotic agent. The benefit gained from a single dose of Abilify can last about 3 days as a result of its exceptionally long half-life of 72 to 90 hours. As a 10 milligram test dose will block 70 to 80% of dopamine receptors in most people, it may be able to stop agitation associated with misuse of various stimulants, medications, and hallucinogens. Prolonged psychotic, mixed manic, or manic episodes typically require longer treatment with Abilify. Abilify has 15 FDA indications at this time, and having this versatile, long-acting medication on board provides a prescriber with several options after treatment of an acute episode of agitation. After a 10 milligram test dose, the cycling mood rating scale is repeated. After 2 hours, a more thorough assessment and history will guide further treatment, which may either be continuation of Abilify at a reduced dose, with an antidepressant, mood stabilizer, or alternative antipsychotic medication, if Abilify was not tolerated. Compliance with taking medication is increased if people feel that a medication is having an effect. If they can self-observe their symptoms daily by using a cycling mood rating scale, they will find that 3 days after a single test dose, symptoms will usually return, making the person understand that medication was helpful in relieving the symptoms for 3 days, helping promote a sense that the medication works, thus increasing compliance. A test dose of Abilify after 2 hours may provide insight into how a medication may affect someone in 4 to 6 weeks after its steady state level is reached. If a zombie-like feeling is reported, it is likely that remaining on this drug at this dose will continue to cause a zombie-like feeling, and a dose reduction is probably indicated. You can learn more about the medication management of bipolar disorder through my website at shrinkharmony.com. You can also find out more information from my book, The Art and Theory of Bipolar Disorder Medication Management, and find out how to attend my neuroscience lectures on Mondays and Wednesdays, 6 to 7 p.m., Saturdays, 9 to 10 a.m., Colorado Mountain Time. From shrinkharmony.com, I'm Dr. David Torres. We'll see you soon.